Yeah, it just seems to me an awful lot of people are actually very sick, because we're not talking about the acute people who will be seen very quickly in our system. Just a few comments to conclude. As long as there are consultants, largely unsupervised, reporting to no one, receiving a salary to treat public patients and allowed to delegate as much of that work to juniors as they wish, and meanwhile free to see private patients for fees, even in public hospitals, nothing can change. The economic incentives are perverse. The medical profession does not advocate care on the basis of need. It wouldn't suit. People buy insurance through fear. There's nothing in it for consultants to lower waiting lists. Quite the opposite. The same doctor you can't see publicly for years, you can see privately next week. That's a similar comment. Maybe Dr. Crown might like to comment on the fact that one would need to be bordering on a genius to become a doctor. Are the numbers being artificially kept down and salaries kept up in the medical profession?
I have to answer. You have to give me a minute to answer those.
Sure, yeah. No, well, there's one other question I'll ask you in a moment.
There is no doubt that if you're privately insured, you will answer. It is a scandal, and trust me, there's no part of me that's ever defended it. I've called it Paris Hilton healthcare in the past, where Paris said she wants to go on the plane and turn left and I'll turn right. It's like that. This was the vision that Mary Harney had for the health system with the co-located hospitals. In the system I'm advocating, and I stress this, everybody is on an equal footing. Every single patient in the country is on an equal footing. They all go to see the same doctors. They all go to the same hospitals. There's no question of you can only with some kind of insurance go to one hospital and with another kind of insurance go to another. Now, on the last one, which is the one which is most clearly factually incorrect about the number of doctors, okay?
Yeah.
The reason for the number of doctors in this country is because it is government policy. You have two forces competing on the issue of the number of doctors. Force number one is doctors who are screaming relentlessly for more appointments in every specialty, and the only people who can make the hierarchical model, which cynically exploits trainee doctors to provide a service which should be provided by senior specialists. And of course, the cynicism here is compounded by the fact that nearly everybody who makes these decisions themselves has private insurance and won't use the system. So the idea that there's some kind of a closed shop exercised by doctors, okay, to keep people from becoming consultants. And I actually heard Lucinda Creighton, and perhaps one of the most ill-informed things I've heard any government minister ever say last week, that kind of closed shop is the problem in Ireland. No. If she wants to fix that closed shop, tell her to go down the corridor, knock on the minister's door, tell him to wrap the knuckles of the HSE and double the number of new appointments. None of us will object.
And what about the appointments at lower pay, a second tier of consultants, if you like, a junior consultant who might well graduate in time to being a senior consultant?
Well, I don't like the word consultant. I don't like the idea of national contracts. And I think a lot of the, really ill-informed arguments which were made over the years here in terms of comparisons of Irish and international consultants were based on this crazy fact that in Ireland, you come in at a certain level and you stay on it until you die. And I just think that's insane. I think the system I worked on, I was a consultant relatively young. I was a